Woman, 34, suffers osteomalacia due to vitamin D deficiency, warning signs to spot. Vitamin D is an essential nutrient needed in our bodies. It helps to regulate calcium and phosphate, which keep our bones, teeth and muscles healthy. Without enough of it, we can experience some serious problems, many relating to our bone health. This was the case for one woman who presented in a hospital in Japan with vitamin D deficient osteomalacia following 2 years of symptoms. A study, published in the British medical journal Case Reports, explained, a 34-year-old Japanese woman presented with a 2-year history of generalized bone pain, muscle weakness and gait disturbance. The patient had been following a restricted diet, without fish or dairy products, and avoiding ultraviolet exposure for 8 years to manage her worsening atopic dermatitis, the most common form of eczema. Physical examination revealed generalized bone tenderness and bilateral symmetric proximal muscle weakness. What is osteomalacia? Osteomalacia is a disease that is essentially the adult version of rickets. Its name means soft bones and it leads to weakened bones that break easily. The most common symptoms are pain in bones and hips, bone fractures and muscle weakness. The impairment of bone metabolism causes inadequate bone mineralization. Osteomalacia in children is known as rickets, and because of this, use of the term osteomalacia is often restricted to the milder, adult form of the disease. In addition to low systemic levels of circulating mineral ions, for example, caused by vitamin D deficiency or renal phosphate wasting, that result in decreased bone and tooth mineralization.
Accumulation of mineralization inhibiting proteins and peptides, such as osteopontin and ASARM peptides, and small inhibitory molecules, such as pyrophosphate, can occur in the extracellular matrix of bones and teeth, contributing locally to cause matrix hypomineralization, osteomalacia/odontomalacia. The patient may also have difficulty walking as a result. Following her diagnosis, the woman was given vitamin D and calcium supplements. Her symptoms improved after oral active vitamin D and calcium administration, the case study said. To the best of our knowledge, this case is the first report of vitamin D deficient osteomalacia in an adult patient due to excessive dietary restriction for managing atopic dermatitis. We emphasize the importance of increasing awareness of vitamin D deficiency as a risk factor for the development of osteomalacia, and caution against excessive avoidance of sun exposure and dietary restriction. She had made a full recovery just 1 year later. The study added, at the 12-month follow-up, the pain, muscle weakness and gait disturbance had been alleviated. How to up your vitamin D intake? Between March and September, most people will be able to get enough vitamin D through sunlight. However, in the autumn and winter months it is difficult for your body to produce vitamin D. Therefore, it is recommended by the government that you take a supplement during this time. Just 10 micrograms, the standard amount found in tablet form a day, is needed. You can also get vitamin D from some foods such as oily fish, such as salmon, sardines, herring and mackerel, red meat, liver, egg yolks, fortified foods, such as some fat spreads in breakfast cereals. Symptoms of a vitamin D deficiency in adults can include fatigue, bone pain, muscle weakness, muscle aches or muscle cramps, mood changes, like depression,